Assalamu alaikum, dear healthcare professions, to this third session of the today. So previously in the two sessions, we discussed the remaining options for the assessing the practical skills of undergraduate students, and then we start in detail about the multiple choice question. So let's have a recap of the previous session. We discussed about the MCQ. So in the start, we discussed the objective, then we have some discussion about the Miller's pyramid, and then we discuss the different categories of the Miller pyramid and which category is actually assessed by MCQ. So that is mostly the which the cognitive domain, the knows and the knows how. And then we some different options used for assessing these type of domain. And then we discuss the different types of multiple choice question. That may be one best answer. That may be true false question. We discuss the two types of each, A type and R type of MCQ, and the standard false type and the K type of the true false question. Then we discuss the pros and cons of the MCQ, uh, the strengths and the weakness of the MCQ. Then we discuss the anatomy of the A-type MCQ. What are the different parts of the MCQ? Then what are the different components of the A-type MCQ? What are, with examples, we discuss what are the context-free and context-rich question. Then the text alone and illustrated text question are example of both context-free and context-rich question. Then we discuss the best choice question, the BCQ, are the rank order options in a good one best answer item. At the end of that previous session, we discussed the EMQ, which is the extended matching question, also known as the extended matching item or EMI. उसकी हमने एनाटमी की डिस्कस की और जिसमें हमने कहा कि इसकी जो अप्रोच है दिस इज अपसाइड डाउन स्ट्रक्चर ऑफ दिस भी है which is start from the option, then leading question, and then stem items. While in the SBA, in the top of the question, that is the stem, then there is leading question, then in the bottom there are the options. So this is an example of EMQ, and now we will discuss about the two rules, general rules of writing the MCQ. So the first rule of writing the MCQ is that we have to decide what is our specialty, what is our theme, and what is our sub-theme. Specialty means which system we are going to deal, what is the module, it is the GIT, it is the cardiovascular system, it is the respiratory system, it is the musculoskeletal system. So as there are modular system different than MSK system that may contain the anatomy, physiology, biochemistry, pathology, management of the MSK. Similarly, all these anatomy, physiology, biochemistry, pharmacology, management, pathology, all of the respiratory, CVS, GIT. So among, first of all, select the specialty, then the theme. Suppose if it is the GIT, so it is the abdominal pain. This is the problem related to the small intestine. It is related to the pancreas. Yeah, if there is any suppose diabetes mellitus, which is the endocrinology or the part of the pancreas. Chest pain related to respiratory system or the shoulder pain related to the musculoskeletal system. So after the specialty, choose a theme from that specialty and then sub theme. Suppose if it is the chest pain, so if either we are the question is regarding the diagnosis of chest pain, it is regarding the investigation of the chest pain, regarding the treatment of the chest pain. So after all these three steps, we should have to be construct a question. And why they are important? Because it will help us in understanding that how many questions that each specialty have, and we will decide the number of questions to each specialty on the basis of the blueprint, which is actually a map through which we can decide that how many questions should a topic have. So it depends on the curriculum. We will talk about in the next sessions, in the upcoming sessions, about what we mean by the blueprint. So after that, after selecting the specialty, the theme, and the sub-theme, the first rule is which is known as the cover the option rule. What does it mean? Cover the option rule mean that the question, the stream after the MCQ, writing the MCQ should be like that. If there are no options, still the person should be able to answer that question. It means the there should be enough information in the stream which can be helpful in answering the question. It means if someone is able to understand and have knowledge of that concept, so he should have the answer in his mind or her mind, and he or she have to find that correct answer in the following options. It means if someone have the clear concept of that topic or that sub theme, uh, so if the options they are covered, still it will be able it will be possible to answer that question. So that basically mean the cover the option rule. For example, there is a question. A 32-year-old male has a 4-day history of the progressive weakness in his extremities. He has been healthy except for an upper respiratory tract infection, and then there is other information as well. Uh, then in the end, that is what is the most likely diagnosis. Now, what that cover the option rule mean? If a student read this information, there are no options. Still, he will be answer the question because there are enough information. He will search that correct option in the following options. So, if the options are covered, still it will be possible, it will be easy or not easy. That depend on his case, but it will be possible to answer the question without the answers. So, this is actually known as the covered option rule. Simple flat question and cover the option rule. Now there is some question in which there is no such information, and if the option are covered, then there will be not possible to answer the question. So the general rule for writing the question is that the stem should have such information that even after if there are no option, it is possible to answer that question. Suppose there is a question: which of the following is true about the studio code? And this is the most common MCQ the examiners often give to our students. All of the following are the correct statement except which of the following is true, which identify the wrong statement, identify the different from options from the following. So like the so if you cover the options, it will be unable to answer what are the different options. So you have not given any option. So this is actually a flat MCQ at which of the following is true about studio. Though it is permissible, but there is flaw, there is technical mistake in that, and the rule which is covered the option rule is not applicable at this question. So if you cover the question, which of the following is true about the studio code, the students will be unable to decide what to answer. Rule number 2. If you want your students to go beyond memorizing facts, your test must require more and more. That's mean when you are making a paper, when you are constructing a test, when you are constructing a bunch of MCQs, you should have the question relevant to different levels. There may be, we have discussed the different levels in the Bloom taxonomy. There are 6 subdomain of the Bloom cognitive domain. This is the knowledge, comprehensive, application, synthesis, and evaluation. This is the old version. In the new version, synthesis is on the top, and evaluation is the second last. Uh, However, the knowledge and comprehensive and as well as the application, these three are known as the low level or the level one, and then the application synthesis and they all they are known as the level two. So, examiner when he or she is going to construct MCQs for the students, so there should be easy question, there should be intermediate question, there should be difficult question. So if all the papers MCQs they are of the level one, again there is a flaw in the paper that a sequence a series of questions. If all of the questions they are in the level two, if all of them they are the difficult, so it will be difficult for the students to achieve good marks, and again it will not give a proper feedback. So if all the questions are too easy, then all of them will have higher marks, and there will be not a biased assessment, there will be not a proper assessment. So when there is you are constructing a series of questions, there should be context-free question, there should be context-rich question, there should be illustrated text question, there should be text alone question, there should be level 1, level 2 question, there should be clinical vanities, problem based questions. So that will make a proper balance bunch paper. This is actually the general rule 2 for the construction of MCQs for the undergraduate level of health sciences. So there should be, and context free and context rich, there will be there if you construct the paper the different level of the cognitive domain. As in the higher level of cognitive domain, when we are checking the differential diagnosis skills of our patient, the clinical decision making of our student, and the different procedure used in the examination, are the treatment methods, are the investigation. So obviously we need context-rich question, the vanities for our student. So these are some examples of the MCQs, and then we'll discuss what is the flaw in that MCQ and what is the best alternative to that. Suppose there is a question, what are the signs and symptoms of multiple sclerosis? And these questions that seem to be okay, but then what is the flaw and what is the best alternative, the correct alternative to that question? So that is the wrong, and the correct one is a 29-year-old woman has a 1 day history of, then you have to the different the main complaint are the history and the physical exam which are relevant to the multiple sclerosis, and there should be enough information that the students they should be able to decide, because many of the diseases they are sharing the same sign and symptoms. So there should be one specific information in the history, in the complaint, in the physical exam will it will make it sure that it is the multiple sclerosis. So you can convert and you can replace this question by this method, and then you add a leading question that what is the most likely diagnosis, and then write down the options. So instead of writing the diagnosis in the question and asking about the sign and symptoms, the best way is to describe the sign and symptom and then let them decide, the student to decide on the basis of these information what is the actually the correct diagnosis of that. There's another question, which is what is the best drug to treat titus media? Suppose that question seem to be best if it is a essay type question, but as we are writing the multiple choice question, the question should be like in that format, which is a 6-year-old boy has a 1 day history of that. Again, same which we discussed in the previous, and like this one, at what immunization should be given to adults. So instead of that question, the question should be a 37-year-old man comes to the physician for a routine health maintenance visit, and then relevant history and physical exam here, and then asks the student about what immunization should be administered. So again, it will help in the patient answering these questions. So, how a patient vanity can be structured, and what are the proper structure? What are the different information a clinical scenario or a clinical vanity should have? There should be age and gender. For example, a 45-year-old man, because some of the disease they are relevant to the children, they are specific to the young age, they are relevant to the geriatric population. Some diseases and disorders they are regarding the male and female separately. So that's why the demographic information should be mentioned here in the form of the age and gender. Then site of the care, where does he visit? He is visiting a physical therapy clinic, he is visiting a physician, he is visiting the OPD of the hospital, he is visiting an emergency department. So it means that person with that age and he is male or female visit which care center. After that, write the presenting complaint, the chief complaint, which is the complaint of that person. That is supposed, for example, uh, a 45-year-old man comes to physical therapy department with psychogenic headache. Yeah, with simple headache. Then what is the history of that symptom, the patient having acute condition, if the patient has subacute, the patient have subchronic, or the patient have chronic condition. So what are the duration of the, what is the history, how much time, from how much time the patient have those symptoms. Then after the therapist will have, the doctors, the physician, the surgeon, that would have some subject to an objective examination, and he or she will have some gathered data in the form of the objective and subjective information, and write down the summary of all those history, which is in the physical finding and the patient history. Then added some results of the diagnostic studies, add some positive or negative test reports, and on the basis of these, as the signs, symptoms, and the history, they may be similar to many conditions, but these positive and negative diagnostic studies, they will help in the differential diagnosis and deciding to rule out some condition and rule in some condition. After that, you can also, as an examiner, you can add the treatment or the other sector, other detail. So this is actually the worksheet for the constructing a vanity, a proper MCQ. This is, you have to write the patient age in gender, which is the demographic information of that patient, then the chief complaint and the duration of symptom, the pertinent history. It may contain the personal, socioeconomic, the family history, and then the results subject to an objective examination, finding lab investigation report, then the lead-in statement, then the option set with the answer indicated, and then this should be A, B, C, D. You can write 4 options, you can write 5 options, you can write 3 or 6 options, but most commonly they are 4, and from depending on the permissible and approved structure of the and format of the paper and MCQ. So this is actually the proper vanity, a proper clinical scenario should be asked in that scenario, in that type. These are some of the examples of the clinical vanities of MCQ from both the basic sciences and from the clinical sciences. From the basic sciences, this is STEM. This is in the leading question, and then these are the options. Similarly, these are the STEM from the clinical sciences. Then the leading question is, which of the following is the most appropriate initial management? And then these are the options, which can be surgical treatment. This is maybe the pyelography and the cystography, CT scan, or the supportive treatment at home, or the barium enema. So these are the different options, and the student have to select one. So these are actually the proper and the this scenario that is actually best for constructing the questions from the clinical sciences, which is obviously including the higher level of cognitive domain. There is a question which is like a 20-year-old male soccer player presents in a physical therapy clinic with a grade 2 right lateral ankle sprain upon evaluation. What are the characteristics of a grade 2 ankle sprain? We will discuss later in the technical flaws that what this is permissible, this is a question, and this is a right question, but what is the technical flaw, what is the mistake in this question? Though it seems to be right, you can have this question in your paper, but there is a flaw, and we will discuss in the upcoming session that what are the most commonly technical flaws and during while constructing the MCQ. So these are the different characteristics. They have been written in the A, B, C, D 4 options, and the student have to read these options, and then there may be up now it is the grade 2, so there should be no complete TDS. Complete rupture is in the grade 3. So the second one, the complete rupture, that is obviously the students should have to eliminate this option. So then the nature of the theory along with the other different combination of symptom they should be made, and then the student have to select one option from them. There is another question. A physical therapist evaluating a 66-year-old female who has a history of severe head trauma following a motor vehicle accident. The patient has difficulty with rapid alternating movement while uh, performing the neurologic testing. The best term to describe the specific impairment is. Now, again, that is age and gender. Then there is history. Then there is the clinical findings, and then there's leading question, which is actually relevant to the problem or diagnosis of that the patient may have the ataxia, dysmetria, dysarthria, and the dysdiadokinesia, which is actually short known as the DUDK, which is equal to this diadochokinesia, which is relevant to the some movement disorder, which is because of the lesion in the little brain, so the cerebellum. So if we check all these four options, what is the homogeneity? All these injuries, all these disorders, lesions, they are due to the lesion in the cerebellum. If it is the ataxia, cerebral ataxia, if it is dysmetria, when the person is unable to judge the distance, when this is the dysarthria, when the person is having problem and during the articulation and speech, and when there is too much problem and too much movement, quick movements, this is the DDK. Another question example of the that clinical vanity, a 79-year-old female, again age and then the gender of the patient, present to outpatient rehabilitation services. This is what is the place he visit, what is that care center. So this is an outpatient department in the of the rehabilitation services. 6 weeks following ACVA with right hemiplegia, she complains of right shoulder pain, working on functional upper extremity movement, and has severe shoulder pain when practicing bed mobility activities such as rolling and scooting. So these are the chief complaints the patient have. On examination, the physical therapist observed that the humeral head is inferiorly displaced. Now these are the clinical findings which the therapist observed during the clinical examination. Which of the following would be the most appropriate for her condition? This is that leading question, and the student, on the basis of the above information, they will decide that what is actually the problem to that patient. Either it is the what is appropriate management for this condition. This is the TENS should be given to that patient, which is the transcutaneous electrical nerve stimulation. The functional electrical stimulation should be given. The shortwave the thermal should be given, and the interferential current IC stimulation. Now check the homogeneity in these options. What is that homogeneity? All these options are relevant to are related to the electrical modalities. If it is the TENS, if it is the functional electrical stimulation, if it is the SWD, which is the shortwave diathermy, it is the inferential current stimulation. All these are the modalities, machines which are using the current, which can be treat the patient with neurological condition. So there should be homogeneity in the options. There should be a leading question. There should be proper enough information, and these information should be on the with the format of this one, which is the Vinity worksheet. So if and it should make perfection with practice. If you are practicing and making MCQ again and again and again and again, it will be very easy for you to make such proper and quality and effective MCQs in a very short time. So the pathologies of the MCQ, different pathology maybe that may be related to the content under a prescription presentation, that may be the related to the domain or the construct irrelevance variance. So the CU or the CIV pathology, we can simply call as the CU pathology or the CIV pathology. So inshallah, these will be discussed in detail in the next session about what we mean from the content under representation, which is actually the CU, or what is the constant irrelevance. Simply, we will have some brief discussion of these two, and then we will discuss in detail in the next session. The underrepresentation CU pathology, yeah, which we can call is the content underrepresentation. The CU pathology mean the question, the stem of the MCQ that does not have that enough information. It means there is inadequate sampling of the content, and that's why there is we discussed the rule one ki cover the option rule is not applicable here. So it means there is a pathology, there is a big flaw. Domain are the construct and relevance variance mean when there are presence of some variables that systematically interfere with the ability of the meaningfully interpret a scores of rating, which means somehow that is related to the content validity, some envelopes, or even that may be not relevant to the curriculum, that may be the questions which are not taught in the question, they are the questions which are not relevant to the module, that module which you specialty which you have been selected. So it means there may be all the pathologies of the MCQ, they may be the content under representation or the CU pathology, or the construct irrelevance variance CIV pathology. So we will discuss in detail about these two types of pathologies, and then we will discuss the sources of CIV as well as the sources and example of the CU with examples, and then we will discuss the management of the MCQ pathologies. So that will be discussed in the next session. Thank you so much to all of you.